sensations affected, you can infer the location of causative lesions. To help localize neurologic lesions, the body is commonly mapped into dermatomes, which are skin bands innervated by the sensory root of a single spinal nerve. It is helpful to familiarize yourself first with the dermatome shaded in green. For example, T4 at the nipple line, T10 at the umbilicus, and L5 at the anterior ankle and foot. With the patient's health history in mind, and after good hand hygiene, you are ready for the physical examination. Begin the sensory examination by assessing pain sensation in arms, legs, and trunk. To do this, first warn the patient, then use the sharp end of a broken cotton swab stick, a previously unused safety pin, or some other suitable tool. Ask the patient to close his eyes, then, starting with the arms, test scattered areas in a symmetric pattern on both sides of the body, occasionally substituting the blunt end for comparison between sharp and dull. Discard the broken swab after using it. Temperature testing is performed when pain sensation is abnormal. Use 2 test tubes filled with hot and cold water.
I got 2 test tubes here. That one's cold and that one's hot.
Okay.
Now you close your eyes. Now tell me which it is.
Cold. Hot. Hot. Cold. Hot. Cold.
Next, assess light touch with a cotton wisp. In diabetics, watch for the stocking glove pattern of sensory peripheral neuropathy.
Now I'm going to touch you with this cotton wisp. Whenever you feel it, you say now.
Okay.
Close your eyes.
Now. Now.
Next, assess vibratory sensation using a lightly vibrating low-pitched tuning fork. Have the patient close his eyes. Tap the tuning fork on the heel of your hand and place it against the soft distal tissue of the finger and large toe and ask the patient to tell you what he feels. Ask the patient to tell you when the sensation stops.
What do you feel?
The same thing.
Okay, tell me when it stops.
Then move the tuning fork closer to the trunk to see if it is perceived. Even in normal patients, some slight distal to proximal gradient may be found. Vibratory sense is often impaired in alcoholic peripheral neuropathy. To test position sense, or proprioception, hold the sides of the patient's big toe with your thumb and index finger. Avoid touching the other toes. Next, ask the patient to close his eyes and identify the direction of motion. Repeat several times on each side in an irregular sequence. Then compare with the big toe on the other foot.
Up.
Again, with the patient's eyes closed, test position sense in the upper extremities, beginning with a finger on each of the patient's hands and moving more proximally to the metacarpophalangeal joints and beyond if indicated.
Here it comes.
Up. Down.
Finally, test discriminative sensations, beginning with stereognosis, the ability to identify an object by feeling it. Ask the patient to close his eyes, then place a familiar object in the palm and ask the patient to identify it.
Small coin.
Repeat the procedure on the other hand, using a different sized coin or a different
A
object.
bigger coin?
Not the same as the other hand?
No, it's bigger.
Okay.
To test graphesthesia, or number identification, ask the patient to close his eyes and use a blunt object to draw a large number on the palm.
What was that?
5.
Using 2 ends of an opened paper clip or the ends of 2 pins, repeatedly touch the patient's finger pad with the 2